Common type of cutaneous tuberculosis is lupus vulgaris if they don't mention if it is adults or in children. But if they specifically mention in children, then the answer will be scrofulloderma. In India, most common is lupus vulgaris. Remember, vulgaris is nothing but it means the most common thing. Tuberculosis of skin, as I already told, these are all the ones. But you remember, lupus pernio is because of sarcoidosis. Lupus profundus is a type of paniculatus. Remember, erythema annular centrifugum is not a type of tuberculosis. If the option is having any of these, then you should mark these as all except answers. Erythema nodosum can be considered as a tuberculosis if these are present in the option for all except question. Otherwise, erythema nodosum is also not a type of skin TB. And lupus vulgaris topic. On diascopy of the lesions, we can see apple jelly nodules. Apple jelly nodules are also seen in leishmaniasis and sarcoidosis. Antitubercular therapy is helpful in lupus vulgaris, and in fact, in few patients in whom we suspect cutaneous TB as a condition which is the cause for skin lesions, and if the patient is not able to be diagnosed with tuberculosis, any GIT or pulmonary tuberculosis, then we'll give a course of therapeutic trial of antitubercular therapy for 2 months, and if there is proper clinical improvement, then we can say that it is because of cutaneous tuberculosis. Sporotrichoid pattern is present in lupus vulgaris. It is also present in sporothrix and fish tank granuloma. Cutaneous tuberculosis secondary to underlying cause due to rupture of lymph node, as I have already told, it's called scrofulloderma. And tuberculitis are seen in lichen scrophulosaurum, as I already told, it's a micropapillary type. Erythema nodosum, if it is the only option present in the 4 options, then you can mark it. Otherwise, lichen scrophulosaurum is a better option. But lichen nitidus and lichen aureus are not tuberculosis. You remember this point. In lichen scrophulosaurum, there will be sweat gland involvement and hair follicle involvement with non-caseating epithelioid granuloma seen on histopathology. For lupus vulgaris to become an answer, the question will have certain pointers like progressive plaque, which is annular, present over the buttock, with center showing scarring. But remember, there are 3 possibilities: center showing clearing and center showing crusting. Center showing clearing, then it is tinea, and if center is showing crusting, then it is leishmaniasis. Mycobacterium causing skin ulcer is ulcerans. Epithelioid granuloma is characteristic of sarcoidosis and tuberculosis. Tuberculosis varicose cutis, as I have already discussed, it's because of post-primary tuberculosis with the patient having good resistance. And for TBVC to be the answer, the question will mention a farmer came with a single warty lesion on the leg because of inoculation due to some trauma. This disease is called tuberculosis varicose cutis, and that's about mycobacterial infections. Now we'll discuss other bacterial infections. Impetigo contagiosa, ecthema, pitted keratolysis, botryomicosis, boil. All these are bacterial infections. Remember, impetigo herpetiformis, pyoderma gangrenosum are not bacterial infections. Impetigo herpetiformis is in fact pustular psoriasis of pregnancy, also called von Zumbusch disease, and pyoderma gangrenosum is a kind of neutrophilic dermatosis. Impetigo is the commonest skin infection in children, mostly caused by either staph or strep. It does not produce any scarring on healing. To be specific, non-bullous form, also called as impetigo contagiosa, is because of strep more than staph. There will be honey-colored crusting seen in this condition, and because of nephritogenous strains causing this condition, we'll have post-streptococcal glomerulonephritis. And bullous impetigo is also called as pemphigus neonatorum. It is caused only because of staph, which will have epidermolytic toxin 1, which cause destruction of the desmoglein 1. There will be hypopyancyne, and there is another condition, staphylococcal scarlet skin syndrome. It's also called Ritter's disease. The main difference between these two is in bullous impetigo, the activity of epidermolytic toxin is local, whereas in Ritter's disease it is spread hematogenously. So it involves all the areas of the body. There will be extensive peeling of the skin in this. There will not be any mucosal lesion because mucosa is mainly made up of desmoglein 3, whereas ET1 is causing destruction of desmoglein 1. Baby is non-toxic, and in this condition we can see Nikolsky sign is positive. So and also the lesions will be usually oral. Here Nikolsky sign is positive. Okay. Coming to the other disease conditions in specific, like Staphylococcus causes eczema, toxic shock syndrome, carbuncle, furuncle, psychosis barbe. But remember, scarlet fever is caused by Streptococcus, erythrasma is caused by Corynebacterium, erysipelas is again caused by Streptococcus. Erysipelas should be differentiated from cellulitis. It can be done because of million eye ear sign. Ear involvement is present in erysipelas. Remember E for E. Ear is involved in erysipelas. And eczema, if it has a tail of gangrenosum, then it is caused because of Pseudomonas aeruginosa. And if it has a tail of contagiosum, then it is altogether a different cause. It's a virus, namely parapox virus or ORF virus. So you must be very careful while answering in the examination. Discoloration of skin can be seen in Kawasaki syndrome, toxic shock syndrome, and scarlet fever. Swimming hazards are that Mycobacter marinum can be spread due to swimming. But certain books, I can't name them, have given answer even as Verruca vulgaris will be spread through swimming. But it's wrong. It is not spread through swimming. Black tongue, also called Lingua villosa nigra, is because of heavy bacterial colonization. Erythema marginatum. I can say that this is one of the confuser with erythema annular centrifugum, erythema nodosum. You all remember that this is a diagnostic criteria for rheumatic fever. Here lesions are serpiginous and evanescent, and they worsen on application of heat. There is one more condition which is closely like it can be confuser. Erysipeloid is transmitted by contact with dead animals seen in dead animal handlers, most commonly pork, caused because of erysipelotrix ruseopathy. Jarish eczema reaction is commonly seen in early syphilis. Discharging sinuses seen in actinomycosis. Erythrasma is because of Corynebacterium minutissimum, which will show coral red color on Wood's lamp examination, and the treatment for this is oral antibiotics, fusidic acid cream. But if it is not showing improvement, then oral erythromycin is the next preferred line of management. And few other confusers are mycosis fungoides, but mycosis fungoides is not a fungal, though the name appears to be fungal. Trichomycosis axillaris is caused because of Corynebacterium tenuis, and Trichomycosis nodularis is a fungal infection of the hair causing piedra.